Well, I'm a pediatrician full-time, and I've been a pediatrician full-time for 32 years. This is my 32nd year. And I specialize in developmental disorders, which includes ADHD and special needs such as autism spectrum. I have a son who is a middle child, and he is my only son, and he is now 25 years old. But when he was 2, he did not talk. And we had him seen by many specialists and determined that he was on the spectrum, meaning he had autistic spectrum. And that just meant that he didn't talk, that he had no language, no eye contact, did not have social interactive skills, and had issues around sensory integration, which meant that the 5 senses that we have were overwhelming for him. For many, many years, in the earlier years when Seth was starting his program, there had been Stanford, and there was UC, and there was UC Davis, and that was pretty much it. So what I wanted to create here, given my opportunity, was to help create these centers of excellence where we would have a multi-phasic clinic, so that would impart psychiatry, psychologists, pediatrician who's developmentally trained, geneticist, neurologist, all of the team components that would be important in terms of observation of a child with autism spectrum and being able to diagnose and give them resources to intervene and counsel families. I sort of see it like I'm an orchestra leader, and I'm basically, the overseer of the whole system and the process. And so that's comforting to parents, because what it does is take that pressure off of them having to do every little thing. So far, we've had this now for about 6 years in gear, and I would say 500 to 800 families at each center have been helped, and it's actually climbing now. And I find that the flow is actually better, because now the physicians, the general physicians, know where to refer to these centers now for expedient care. But I think what is unique about what I have to offer to the community is that I'm a parent of an autistic child, and I'm a professional, and have handled subspecialty practice as well. So I can impart information that helps not only to teach other physicians to do early intervention and treatment, but also help families who are coming to me in distress. They really are looking for hope when they come in that door, and they want to know, okay, you have a son with autism, what was the outcome there? Now that may not be the same outcome for the patient I'm looking at, but I can offer them hope. And this is not a procedural evaluation, so it's not like a lab test is going to give you the answer. The treatment is to help them to get their output, because most of these kids are not talking or not talking correctly, and they need to imitate a pathologist, a speech pathologist, to get information about how to speak, how to articulate those sounds that are so difficult for them, and put words into phrasing, phrasing into sentences, and in sequence. The physical therapy is something that we do for actual direct muscle involvement. The occupational therapy that I mentioned, the OT, is actually specific for balance, coordination, and what it does is allow that person who's on sensory overload to lower that down so that they can tolerate input a whole lot better. There's so much that we can do, both at home and at school sites, that it just behooves us to get those kids in there early, get that stuff going, get their speech going, get them to handle behaviors better, because you know they're going to be more successful in the end. Yeah, he's had a marvelous journey. It was not so easy at the beginning. And he got a BA degree in drama and dance, and now he's an actor, and he's 25, and he is living on his own, driving, has a little girlfriend, and he works. And he's contributing to his rent. So we're very, very excited. He's been in 3 shows out of college and continues to audition and do well, and ultimately his goal is to be in musical theater in New York City. Well, I have a website with autism resources. One is at Kaiser. It's www.kp.org, and you look for my name, Ivy Fisher, and on my website, my home site, it will have a lot of autistic resources. Cambridge Hoo-Hoo also, because I am a professional member there. I want parents to know that there is help out there now, and a lot more help than we ever had before. You know, see your doctor. Your doctor will get the help and information and resource to you, and we will get your child intervened and treated ASAP.